I'm a good man with a good heart. Had a tough time, got a rough start, but I finally learned to let it go.
If you are overweight, summer may be your least favorite time of year. We are hoping to change that this morning with some great options for you. We're joined by Dr. Julie Ellner through the Alvarado Hospital to tell us what we can do to lose that weight. Good morning.
Good morning.
A couple options for people this morning. Tell me what the best way to lose weight is.
Well, for people with serious weight problems, like people struggling with 70, 80, 90 pounds or more to lose, it's really been found to be a surgical disease where those patients are really struggling with a genetic problem more than lifestyle, so we need to get inside and help patients change their metabolism. So the gastric band and the gastric bypass are the two most popular ways for patients who need to lose significant amounts of weight.
What is the most significant medical reason that someone would have a surgery like this?
Many patients with medical problems like hypertension, diabetes, sleep apnea come to me because of those medical problems. Sleep apnea typically goes away within a month, and diabetes and hypertension go away within 48 hours after the gastric bypass.
And what about the lifestyle reason that someone would come to you? You know, sometimes it can be beyond just being uncomfortable and they don't want to be in a bathing suit. It can be the medical reasons, but what about lifestyle too?
Many patients come to me just because of lifestyle issues. They feel like they're really being held back by their weight. They're not able to be the parents that they would like to be because they're not active. They're suffering from joint pain. They're taking pain medicine every day. And they just feel like they're being weighed down in life by being slow and in pain all the time.
So there's so many fad diets out there right now, and then we have, the Slim Fast and all those different things that people can do. Why is that not necessarily a good option if you are overweight by a certain amount?
That's right. Those diets can be successful if you have 20 or 30 pounds to lose, but they've been consistently proven to be unsuccessful for people with more significant amounts of weight to lose. Dieting actually makes your hunger hormones increase in your body, so the more you diet, the more chemically hungry your body becomes and drives for more food over time.
Okay, so we have really significant results to show this morning. I know this is something that you love doing because you are able to give people their life back and help them to feel so happy. Tell me about this person here.
This is Jody. Jody came to me when she was about 26 years old. She was getting sick. She was too sick for a 26-year-old. She was exhausted all the time. She had hypertension, sleep apnea, joint pain. All those problems went away almost immediately after her surgery. But for Jody, the neatest part of weight loss is that she was infertile due to the hormonal effects that happen in a woman when she's very overweight.
Oh, wow.
So now that she's had the surgery, her fertility came back very quickly. She got pregnant about a year after her surgery. And since her surgery, she's had two beautiful little boys. So I think if you ask Jody, the neatest thing for her in terms of her surgery was really being able to have the family that she had always dreamed of. And of course, she isn't sick anymore, so she doesn't have those medical problems nagging at her anymore.
Wow, that's unbelievable. Oh my gosh, take a look at this dramatic weight loss. That is quite a significant amount.
This is Mike. Mike's a really neat guy to meet, and he frequently comes to my lectures, and I'm giving one next week. Mike is an interesting story. He and his brother own ML Larson Construction, so he needs to be an active guy. He was suffering from a lot of pain in his joints, pins and needles, numbness feeling in his feet. He had terrible sleep apnea, a lot of medical problems nagging at him. But at the end of the day, what really motivated Mike to have surgery was his little boy, who I think is in one of these pictures here.
Yes.
And it was just wanting to be a better dad, a more active dad, to be able to go out and play baseball with his little boy. So
that is so sweet.
His weight loss has really, I think, made him a better father and made him feel like a better father.
That's got to be so rewarding for you to take a look at these people before and now after, how much their life has changed. And tell me about this case here.
Rachel, she's an amazing story. Rachel came to me like so many young patients, just kind of feeling like she's not really that sick, but she felt like her weight was, again, slowing her down. And when we got into her medical history, it turned out that she really did have more medical issues going on. But after her gastric bypass, she came to me about almost 250 pounds. Now she weighs about half that.
Oh, wow.
But the neat thing about Rachel is that she's getting married this year, and when I tell you that she is stunningly beautiful, This girl is going to look like a princess at her wedding this year because she's statuesque. She looks like a model.
Oh, that's so great.
Yeah.
Well, you know, the best thing about your job, you were saying, is really helping people and transforming their lives, and that's what you can do for them. We have a seminar to talk about.
Right.
It's happening next Thursday on the 14th at 6 o'clock, Alvarado Hospital. Tell me what people can learn at this seminar.
This is a great, really informal way for people just to gather some information. Some people come to this lecture having done months or years of research, and they sit right in the front row and ask me questions. And other people are just sort of dabbling in it just to learn more. So it's a great way to just get a lot of information all at once. But many of the patients that we featured here today are coming to the lecture. So it gives people a chance just to ask a little personal question of a patient to say, really, what was it like to go through this? And I think that's very meaningful. And it's great for my patients to be able to reach out to people who are suffering from the same sort of thing that they were experiencing before surgery.
Sure, it helps them relate and then helps them see what their life can be like after this type of surgery.
That's
well,
right.
thank you so much for coming today.
Thanks for having me.
Such great offers, and can really change your life if you are suffering from being overweight.
That's right.
Thank you so much. For more information, as always, head to our website, san diego6.com, and just click on San Diego Living.